Facial assessment. So the way I approach the face in terms of my assessment is I consider the gaze analysis from Harvard. And what it says is the first thing someone looks at is your eyes. The next thing someone looks at is your teeth. The third thing someone looks at is the shape of your face. The last thing someone actually looks at is your nose and your lips. But the first thing someone tends to have done is their lips, their cheeks, and they might consider a septorhinoplasty on top of it. So when we're assessing the face, what we want to do is we want to look at your best feature and your weakest feature, and we want to correct the disparity between the two. On top of it, we consider the selfie side because of Instagram now. So we might say, which one's your selfie side? Most people would pick their selfie side as being where their dimple is, or where they have less acne scarring, or where they're more defined, or where the brow of the arch is higher. So these are all the things we consider in terms of your psychosocial behavior for Instagram or digital platforms or images. Then the other thing we look at, and especially when I walk into the room, and this is when I really shock my patients, I say, oh, you've got mum up here and dad down here. And they're like, how do you know? And I turn around and say, listen, I've been doing this for 2 decades. I can turn around and look at skeletal aging, and I can literally figure out where you've got male features and where you've got female heavy dominant features as well. So this is what I look at when I'm assessing the face. So the first thing I look at is your eyes. In terms of your eyes, I'm looking for hollow, I'm looking for any pigmentation or any changes. Next thing I'm looking at is your teeth. Are they straight, white, do they suit you, do you have veneers? Because any dental work can move the area of the mandibular and maxillary complex. Then I'm looking at the shape of your face. Is your jawline defined? Is your cheekbone prominent? So I'm looking at the shape of your face. Then I turn around. When I'm looking at the shape of your face, actually, what I'm looking at is your jawline defined? Is the distance between the corner of your mouth and your tragus more defined? Is your zygoma and cheekbone high? That's the kind of way I assess you. Then what I look at is the angle of the nose, the lips, and the chin. Some people have a retrograded chin, some people have a chin that moves anteriorly as a gift from their genetics. So I'm looking at this angle, is it too prominent, is it too retrograded? Because that's my job to correct it. Then I'm looking at the corners of the mouth, are they downturning? Then I'm looking at the folds over here, is it too heavy? Because most people would come in and just treat that, but you become chipmunky. So you have to assess the face correctly. Then what I'm actually looking at is your lips. It's one of the last things I actually look at. And when I look at your lips, I just turn to the side and say, let me look at the projection. Can I see the shape? Is it distorted, or is there a nice cupid definition or rounding? Because some people prefer a rounding arch on top of their lip. Then I'm looking at the brow and the arch of the brow and temporal recession, because if you've got hollowing here, this can be a little bit lax here, or it can be a bit egg-shaped. Then I look at the mid-cheek, especially in men. That's one of the final things I look at, because if you're working out a lot, you can have malafat pad regression or wasting over here. Or if you've got a prominent nose, I turn around and say, if we build you, we lateralize you here, we define you here, and we give you a little bit of mid-cheek, then the silhouette turns and looks differently. So that's how I assess the face. And that's the way, anatomically, you should consider assessing the face. And then when I turn around, I inform you of your selfie side, which you're normally like, how do you know, again, but I also teach you how to do it as well. Because fundamentally, my job is to create the distance between your selfie side and non-selfie side, reduce that distance. But one thing I do share with you is don't chase symmetry. Because if you chase symmetry, you're going to get more and more distortion. So asymmetry gives you your individual features as well.